the field of cerebral palsy is in kind of an interesting place right now, in that we're learning a lot more about different potential causes for what can look clinically like cerebral palsy. So there are a lot of genetic causes of cerebral palsy that have come to the forefront. And there are a lot of other disorders that we're learning about that look like cerebral palsy but aren't and are treatable. So because of that, the diagnosis is getting more and more complicated. So knowing that, we wanted to figure out if amongst specialists that are typically dealing with children with cerebral palsy, are they diagnosing cerebral palsy differently amongst them? Is there practice variability? So we surveyed a large group of physicians that have demonstrated interest in cerebral palsy, either through membership in Child Neurology Society, through certain special interest groups, or in membership in the American Academy of Cerebral Palsy and Developmental Medicine. And we surveyed lots of different specialists, neurologists, physical medicine and rehabilitation specialists, orthopedic surgeons, pediatricians, and there were some interesting findings in terms of how they might diagnose cerebral palsy in the setting of a genetic cause and in the setting of the child having a lot of low tone or hypotonia as the main cause for their motor disability. So the way we surveyed this group of physicians was by providing them 4 standardized hypothetical patient scenarios. So in one scenario, there was a child who was born premature, had motor disability that was non-progressive, and it was from high tone in his legs, spasticity in his legs. There was another scenario where a child had the same exact phenotype clinically, but had a genetic etiology for those same symptoms. And the presence of that genetic etiology made people diagnose cerebral palsy much less than the child without the genetic etiology. And if you had a child with very low tone as the cause for their motor disability, even if that motor disability wasn't progressive, people diagnose cerebral palsy much less frequently in that child too. So it just points out that people are diagnosing cerebral palsy a little bit differently when there is a genetic cause and if there's low tone. So these are areas that we really as a field need to focus on and come up with a consensus for to decide that these children really do have a cerebral palsy phenotype. We should be giving them a diagnosis of cerebral palsy.